What do you do if you see that excessive low back arch, that really big anterior curvature, which is hard for me to even do, when someone's going through the overhead squat? We're gonna go through our 3-step process of mobilize, activate, and integrate inside this video. The first step is mobilize, and when it comes to this movement posture that we might see, there's 2 potential areas of overactivity. First is gonna be the quads and hip flexors, right? If I have overactivity, that could be pulling my hips out of position. The other that you'll find in the NASM material is the lumbar spine, like our rector spinae. Personally, I find that to be less common. I find that more often than not, it might be those quads and hip flexors that are pulling us out of position. So if they are, this is probably one of my top 3 areas. Personally for me, because of the teaching element, because of the time it takes, I don't use SMR and foam rolling for every client, for every part. The quads and hip flexors are a common one that I'll do, because for a lot of people, if we can just get a little bit of relaxation before we go into our next step, which is some active isolated stretching, we can get some great range of motion. So in doing so, maybe I'm gonna spend 30 seconds to a minute on each quad, all right? Elbows planted on the ground, good tight core position, almost like a plank, and I'm moving slow. All right, that's one key if you guys are gonna do SMR. We don't wanna be flying back and forth through all over the place. You want some tension. And then if you find a good spot, for some people that may be mid-quad, for others, maybe it's further up, almost near your hip and your hip flexor, then just flex and extend that leg, all right? Once I've done that for 30 seconds to a minute, we're gonna go right into potentially some static or some dynamic stretching. You might have even seen this inside of our other flexibility videos here on the YouTube channel, but one of my favorites, one of the most intense too, whether you use a wall, whether you use a bench, called the couch stretch as well, is gonna be this stretch. Now this can be done static. I'm a bigger fan of doing a little bit of active isolated. So again, if this is an area that's really restricted for somebody, a little bit of foam rolling first, and then going into this position. Hand planted on the thigh, and what I'm gonna do here, I'm gonna try to tuck my hips under. A little bit of a glute squeeze. Hold that for 3 to 5 seconds, all right? And then relax. If you keep in mind reciprocal inhibition, if I can take advantage of that a little bit here in mobilizing, engage the glutes, that's also gonna help shut down those hip flexors and quads. After step 1, after we've done some mobilizing, now we're gonna wanna activate, and specifically the areas we wanna activate when it comes to this position, the underactive potential muscles, core, right? Potentially our core musculature, especially deep core muscles, may not be helping us keep a better relationship between our hips and our ribs, which we usually don't want to separate. And then on the flip side, if we've got underactivity here in the core, we may also have underactivity in the hips, the hip extensors, the glutes, the hamstrings. So the first thing we're gonna do is address the core. My experience, it's a mixture of both, but this alone can be a great place to start. And easy, but oftentimes not done with a lot of intention, could be dead bug variations. All right, now if you're familiar with a dead bug, I'm gonna give you guys a couple new cues. If you're not, this is a great place to start. All right, because especially when it comes to the squat, we're trying to improve our hip and core position in this hip flex position, right? So in many ways, even though I'm unloaded on the ground for the dead bug, the nice thing is it does bring me into a position that's gonna simulate or look a lot more like our squat versus maybe other core exercises. A lot of core exercises could work, but I'm gonna start here because this is a really great place for some of your clients, especially as they're first getting into the gym. So one of the key variables here, no doubt we have a natural curvature of our spine. When I'm coaching this exercise, usually we're trying to get rid of it, right? So even if you're just lying on your back for a second here, first step might be just teaching them to compress, press the low back into the ground. Really what we're doing is a posterior pelvic tilt, all right? So that's what you wanna feel. And if you're a coach, you wanna look for that while we're doing this exercise. Then I wanna bring the knees in, at least to 90, all right? Maybe even greater at the hips. If I can maintain about 90 degrees at the hips and the knees, and then same thing with the feet. Small thing here, keep them dorsiflexed in, all right? If I have someone doing this dead bug and we see the ribs poking out, not what we want. So I find one of the best ways, and I gotta give kudos to my man Tony Gentlecore for picking up this cue, which is actually just cue pushing the hands up. If you're coaching above them, have those hands out there and tell them to keep their head down, but just push those hands up. That alone, boom, it's gonna bring the rib cage down, and you'll feel, even as I'm talking right now, I feel some core engagement. So here's step 1. And then nice and slow, all we're doing, slow extend out of that leg, keep reaching the fingertips. Deep exhale, slow reach out. Deep exhale. That alone can be a really great place to start. In general, anything that's gonna be more core stability, core engagement is gonna be helpful, but I find that's a great place to begin. Going right from there, because we're already in the position, if we're addressing a little bit of the core, we can also go right into the hips, right? Weakness or potentially underactivity also on the glutes and hamstrings. So you can take and apply that same ribs down position, push the low back in, and that could be a great place where we're starting to teach the bridge too, all right? Lots of variations we could go from here, but if we're trying to maintain no movement in the back, you wanna make sure you're not seeing this, right? Where we get this excessive movement in that lumbar spine. Push the low back down, pressing up, and maybe even just work on isometric holds, all right? My next favorite place to go here, because it's kind of 2 for 1, as you go single leg, all right? No doubt we could just teach single leg here and emphasize proper position, which you should, but I also like, because sometimes external cues can be super helpful in engaging the core. We already identified core engagement and glute engagement. Well, we've got one exercise that can do both, and this is an isometric glute bridge. Either hand can work. I kind of like the opposite of the leg, but I'm gonna push. This is isometric, I'm driving up. The nice thing here, I'm getting hip flexor and core engagement. That's gonna lock that lumbar spine in, and then I'm gonna bridge up. And I'm telling you guys, even if you're watching this right now, pop down and try it. Your butt will thank me, all right? This one's a ton, but the nice thing is it solidifies the problem that that person might be having, which is just creating more tension through the core and the pelvis so that we're moving from the right areas. Step 3 is we need to integrate, right? We need to integrate what we've already worked on. We've mobilized a little bit. We've got some activation, hopefully in the right areas, especially our core and our hip extensors. And now we want to apply that to the squat position. One of my favorite ways, there's many strategies we could use, would be the counter lever squat, all right? You can use any weight plate, medicine ball, generally for smaller individuals, maybe something like 5 pounds. For larger individuals, maybe around 10. Doesn't have to be heavy. But the key here is we're going slow, and we're watching that lumbar spine. Now the cool thing is, if you use this in a first session where you see the lumbar spine, it's kind of a cool little trick because you might actually fix it just with that. But this is gonna force me to now engage my core in the bottom position. Slow, exhale, right? Drop down, hold, right back out, all right? If you're doing these right, not a lot of weight, should give you quite a bit, and ask as you're going through, should give you quite a bit of core engagement, and as a coach you're just paying attention to all of a sudden, are they able to maintain a nice flat position? If so, then it should be a good indication that you're on the right path, right? You're on the right path of giving them more engagement at the bottom. For a lot of people, even just coaching them to brace might improve that lumbar spine, which is a lot easier when the hands aren't overhead. If that doesn't work for you guys, then hey, guess what? It's training, it's problem solving. You might find that you need to play with foot position, and all of a sudden, that movement in the low back and the lumbar spine goes away. But hopefully this should give you guys a good idea of where to start with our 3-step process of mobilize, activate, and integrate to get rid of that lumbar movement.